Dr. Quick, the Sniffles thing, I got to be honest, I went ballistic as someone that touched upon science. How do you respond to a president who looks at this virus as the Sniffles?
Well, I mean, it's clearly a virus that is not the Sniffles. I mean, we've seen how it spreads, how it creates severe illness. I mean, we have. I mean, one of the distinguishing features of this coronavirus is its ability to crash intensive care units. And the length of stays for people who do need serious care, and that's at least 5-10%, depending on the location, sometimes more. The length of stays are unprecedented. So it's a stealth virus in the sense that perhaps a third of the cases are asymptomatic. So it's a real challenge, but it is a absolute. I mean, it's a nightmare
right.
as a viral enemy.
Dr. Quick, the president seems to be grasping at the idea that it does not have a profound effect on the young. Early on in our discussion, we spoke to a radiology expert at Mount Sinai who made clear that wasn't true, that there was damage, if not death, to young people. Can you agree with that 4 and 5 months on?
Oh, yeah, yes, indeed. I mean, it is the case that it's less frequent, but we are seeing a unique inflammatory response in children, in kids that will affect the blood vessels and their health in the brain and in other parts of the body. So yes, indeed, it can cause serious illness at all ages, though indeed much less common at the younger ages.
Dr. Quick, there have been a number of studies showing that children do, in fact, spread the virus, perhaps less so when they're under the age of 11. But nonetheless, they have traditionally been vectors of disease, and this virus is no different. I'm wondering, do you think that we can reopen schools, given the levels of infection that we're seeing throughout the nation right now, as well as the challenges of getting the kids to their schools?
Yeah. In places, it's difficult to imagine in places where cases continue to rise exponentially, opening schools at this point. And it's the children, it's the teachers, it's the bus drivers, it's the food service workers. It's taking it home to the parents, but then on to the next generation. So each community needs to make, or a locality, a decision based on the risk there and the state of the epidemic there. But I can't really imagine a wholesale nationwide opening.
Yeah, Dr. Quick, Peter Hotez is literally, as we speak, tweeting about this. Of course, the giant in virology from Baylor University as well. What is your prescription then, as Lisa mentions, what is your prescription to go community by community, school district by school district, public school by private school? How do we affect that literally tomorrow?
So doing it tomorrow isn't possible. We don't have guidelines. So one of the things the Rockefeller Foundation has done last week, we launched a Getting to 30 Million and Beyond report on testing. And one of the critical elements of that is protocols, guidelines, risk-based guidelines for schools, for nursing homes, for at-risk workplaces, vulnerable communities, because the states and counties and school districts shouldn't be on their own to figure it out. They need some systematic guidance, and we would love for that guidance to come from the CDC or Health and Human Services, because that sort of concrete guidance is what's needed to get the right testing in the right place to monitor the disease.
Yeah.
I mean, if you don't have that, and the first sign is, a third of the kids out and teachers getting sick, that's too late. You need to be monitoring and doing screening tests, rapid turnaround screening tests. And we're at 5 million tests a week now. We need to be at 30 million tests a week, particularly going into the fall. We will have flu. Distinguishing flu from coronavirus is it's essential in order to keep our schools and workplaces as functional as they can be.
Dr. Quick, Hong Kong went back into lockdown after 100 cases of coronavirus were diagnosed. Back in the U.S., it's almost laughable that 100 cases would cause a lockdown. Which approach is the right one?
Well, you need to have a threshold. So as we begin to open workplaces and schools, you need to have in mind at what point you say this is getting out of control and we're going to close, not permanent. We may close for a few weeks. And so that kind of guidance is what we need to have here. I mean, it's in some ways analogous to the decision about snow emergencies. I mean, you have a threshold and you say, look, at a certain point, it's unworkable and we will close. In the case of coronavirus, that closures needs to be several weeks. But even the question of opening, you need to have some clear guidelines on when you're going to open.